Are you back in any way in your capacity as a surgeon or a doctor? Are you doing any of that stuff, or are you still on the road to recovery?
I am. So I'm back in the capacity of like a clinical urologist. So I can see patients in the clinic, make diagnoses, prescribe, and I can do some very minor procedures in the clinic. I'm still not quite to the place I need to be to do any significant operations like in an operating room. I still have some left-sided, left-hand ataxia. My balance is a little off. The balance issue is not enough to really, preclude surgery or anything. But the left-hand fine motor manipulation is still fairly off. That may keep me out for a while.
This is the Recovery After Stroke podcast with Bill Gasiamis, helping you navigate recovery after stroke.
Hello and welcome to another episode of the Recovery After Stroke podcast. My name is Bill. Thanks for being here. Now, if you are a regular listener or you just come across the podcast for the first time, please do me a favor. Please comment, like, and share this episode because it's likely that you found out about the podcast because it was shared, somebody commented about it, or you did a Google search and it came up on your feed and you needed to hear about it and you needed to know about it and you appreciated it when you found it. If you're one of those people, then please repay the favor to whoever it was that commented, liked, shared, or did or had an interaction with the podcast, which put it up higher on the Google search results or on the algorithms that give you information when you start searching for them. The reason being is because I started this podcast because I was missing this type of information when I was recovering. And my aim is to get in front of as many stroke survivors and their caregivers as I possibly can, so that they can be inspired by all the amazing stories of recovery, resilience, overcoming stroke that all my fabulous guests are going through and are sharing. If you think the show deserves it, I'd love it if you leave the show a 5-star review. It will help the show rank better, like I said, on search engines, and it'll help newly diagnosed stroke survivors find it easier, and it could make a massive difference in their recovery. And I hope it's making a massive difference to your recovery. And it's something that you are looking for, that you really needed. And it is really a big deal to me when I get the feedback from people telling me how much they love the podcast. It makes putting in the at least 8 hours that it takes to get every podcast episode recorded and edited and live really worthwhile doing. So that's what it means to me if I get this type of feedback. Now, there has been some feedback and I have seen a spike in comments, but I want more. I want more 5-star reviews. I want more amazing comments because it really is uplifting and it makes a difference to me. And hopefully it'll make a difference to other stroke survivors. Now, I want to share a couple of comments that people left. Talent Searcher on the Apple Podcast app left a comment regarding the interview that I did with one of the guests, which had a stroke because of cracking his neck. The comment goes, "Thank you for this podcast, inspirational, courageous, and informative." Now, Brass Anchor, and I love the names that people leave behind. Brass Anchor said, "Very informative and worth the listen. Thank you, Bill, for an incredible series, shedding light and sharing wisdom. The interviews and stories the guests share are touching and informative." So it's making a massive difference. It is. People are loving it, and more people need to see this. I've noticed that as more podcast episodes are being reviewed and as more people leave a review, that the show is increasingly reaching more and more people. And that's all I could ever ask. And enough of that from me for now, because I could go on about that for ages. Now, this is episode 197, and it's another cracker. My guest today is Dr. Bevan Choate, a surgeon who experienced a vertebral artery dissection that led to a left cerebellar stroke when he was aged just 35. Since then, about a year or so ago, he has taken up painting with a palette knife and written a book called The Stroke Artist. Bevan Choate, welcome to the podcast.
Thank you. Happy to be here. I appreciate it.
My pleasure. Thank you for being here. Tell me a little bit about what happened to you.
So yeah, just in terms of, I had so in it was December 3rd of 2020. I was, kind of set the stage. I was in the prime of my career as a urologic surgeon, and just getting up one morning to go to work, just like any other day. Woke up terribly dizzy and just hit the ground like a ton of bricks. And room was spinning, double vision. Couldn't seem to even stand up. I was, things were spinning so much. And my wife finally convinced me to go to the emergency room. After some refusals and things like that. And once I was there, the sort of conservative management things weren't really working out, and so they asked if I wanted a CT scan. I said sure, because I really didn't want one, but I got one, and there was a what they called a large hypodensity in my left cerebellum, indicating I'd had a pretty large ischemic stroke. And if a urologist can basically read that CT scan, then it's pretty bad. So yeah, I'd had a left cerebellar stroke, and that was kind of the sort of the ground kind of fell out beneath me.
Why didn't you want a CT scan? Afraid of what it was going to reveal, what you knew it was going to reveal?
Yeah, I mean, a combination of like, I think I know what's best for me, like a little bit of hubris, a little bit of maybe in the back of my mind, if I get this CT scan, then I know what it might mean. And with the way the presenting symptoms were, I was kind of like, I'm 35 years old. There's no way in hell this could be anything serious, right? Like it's probably an inner ear issue, and it definitely wasn't. So they said, yeah, this looks like a pretty obviously a stroke. And I said, yeah, I see that. and so then it was rushed to the the university hospital. The problem was presumably, I had this sometime in the middle of the night while I was sleeping. And so we had no idea when the stroke actually, began occluding blood flow and everything. So it wasn't like I could get TPA or anything like that in the nice magic window. So I had to be taken really to the only hospital equipped to handle a stroke in New Mexico, which is a pretty rural state.
Yeah. We talk about doctors most of the time, not very lovingly on this podcast. Not that we're rude or anything like that.
Right.
It's that a lot of people have had the experience of medical doctors where they've done exactly what you did to yourself, which is, I'm 35. I walked in there, I told them I was having a stroke, and they looked at me and said, you're too young. It's not that. Just sit on, go into the waiting room and wait.
Right.
Is it that? What's the word? How can I get there? Is there that much naivety in the medical professionals that work in the hospitals that stroke doesn't happen to young people? Because it happens in utero, it happens at every age, and then of course it happens at a greater quantity in people who are above a certain age, say call it 65 plus. But is there that much naivety that somebody presenting with stroke symptoms isn't having a stroke simply because of their age?
I don't know if it's, I think it's just that, I think when you're sort of like a budding physician and that sort of thing, you always want, you want to go zebra hunting, as they say. You want to find all the interesting things, and at some point it kind of gets beaten out of you that or more like beaten into you that common things occur commonly, and when you haven't seen maybe a stroke happen to someone younger than 50 and 10 years, it's sort of a shock or a surprise to everyone. I mean, in my situation, I don't think anyone was really putting on airs or or sort of saying like, well, I don't really think this is a stroke. It was more like myself saying that.
Yeah.
I'm in my situation, I'm probably not qualified to really, obviously make my own self-diagnoses, but because what I deal with is more like genitourinary tract type stuff. So I mean, my extent of stroke knowledge is more like, just the very obvious things like unilateral weakness, but like with an atypical presentation like this, it was just not really on my mind at all. I mean, I was healthy, still am, but I didn't have high blood pressure. I didn't really have, my lipids were normal. I ran 12 miles a week, went to the gym. I just thought, like, how impossible would that be for me, so it just really wasn't in. I mean, I guess you could say that it was in the back of something like that was in the back of my mind, but I was kind of like, okay, don't freak out. Let's think about the most common thing here. And I said, well, it's probably like, benign positional paroxysmal vertigo. That's what it is, right? And then it was, definitely was not. So yeah, I don't know. I think it's just, it's really interesting to talk about like physicians in the realm of like neuroscience, because when you're in medical school, they teach you all of these deductive reasoning skills and things like that, and I mean, we use them, but not all of the time. And according to, I think it was a neuroscientist in California had done a study about this. I can't remember the exact person, but it was like tried to understand how physicians actually think when, like, and I think they did the study on ER physicians, and really they're more like AI computers than they are these like deductive reasoners. Like it's all about pattern recognition and stuff like that. So when you see a healthy 35-year-old guy come into the ER, you may not instantly have stroke on your differential. It's probably maybe in the top 10, but it's either 9 or 10.
Yeah, I do understand. Now, when I say we have, sometimes we don't say a nice thing about doctors, it's because doctors have been put on a pedestal, and sure enough, they deserve to be there to an extent, right? And then we are the majority of the people that go into a hospital are completely ignorant about anything medical until something goes wrong with them.
Right.
And then we go to the hospital and we want this perfect diagnosis. We want the doctors to be on their game 24 hours a day, 7 days a week, to work it all out, like they do on the TV shows in half an hour,
right,
and solve the problem in the next half hour. And when that doesn't happen, we feel let down, and we feel like the reason has got to do perhaps with the doctors or the hospital or the nurses, or somebody could have picked it up or done better or whatever. And we don't understand the pressures that all of the medical staff face within a hospital, let alone do we understand what happened at home for them that day, let alone do we understand how they are just human and they make mistakes and sometimes things don't go right. And that's really difficult to accept sometimes when you're looking for blame, when you're looking for a way to understand what happened to you and why it happened to you, and there's no direct answer for some people with strokes that don't have a cause, that just occur. And it's like, all right, it was probably the doctors. I'm this way because the doctors stuffed up or whatever. So I feel like you guys are also scapegoats, but I know for a fact I wouldn't be here without doctors. Not one single doctor who helped me didn't. They all contributed to me being here interviewing you today. Every single one of them. Doesn't matter whether they did supposedly a fantastic job or a terrible job. Every single one of them contributed. So did the nurses. So did everybody. So I don't. I'm not making that comment lightly. The one that, we don't speak of doctors quite nicely, but it's not from a lack of wanting to or having faith in their abilities or being completely, totally grateful for our outcome and what they did. It's more from that, I think, early on, that situation where we're looking for a way to reason our way out of what's happened to us. And there just isn't one, really. There isn't.
Yeah. And I mean, yeah, it's interesting that one of the first things people ask me when they find out that I had a stroke, well, they're like, well, what caused it? And I'm like, well, it was a left vertebral artery dissection. And then after I tell them what that is, then they're like, well, what caused that? And I'm like, well, I don't have an answer for that. We did the $1 million workup, and there is no answer. And people don't really necessarily like to hear that.
No, I did a few interviews just before this one. I've done another 2 today, but the ones I did last week were just not yet released. One of the guys clicked his neck, did that thing that we all do. They just and caused himself a vertebral artery dissection.
Yeah.
And some of the people that I've spoken to that have had either carotid artery or vertebral artery dissections came from the most benign movement. One girl looked down in the wrong direction with her head or something, and it caused a dissection. And it's it's like the craziest thing, and it's just so unbelievably difficult to wrap your head around that. But that's an injury that's occurred, just like sometimes you strain your back or you roll an ankle or you do something to your thumb. That's just one of those things. It just seems benign, but it happens in a place that's serious and important, and as a result of that, it leads to, for some people, catastrophic injuries because of the clot.
Right. And and I got all of those questions. Did you were you doing Brazilian jiu-jitsu? Did you go see a chiropractor? Did you did you get in a car wreck? And the answer was all no. It's just who knows exactly what I did. But when I look back on it and the timing and everything, and I'm like, yeah, I guess, because there usually is like some degree of neck pain that precedes it by maybe 2 to 4 days, and I do remember that. But I always had neck pain. I'm a surgeon, so my neck's always hurting, and so it's like. So I didn't think it was any different, but now, looking back, it does make a little more sense.
Yeah. So looking down is something that you do a lot, and I've interviewed people that have had dissection because of Brazilian Jiu-Jitsu.
Yeah.
I've interviewed people that have had a dissection from a collision in a car. So all those things that you've mentioned.
Oh yeah.
And in one of those interviews, I'm pretty sure somebody mentioned that the doctor who treated that person in that particular part of the United States mentioned that you have lumberjack's disease. And it's like, whoa, what's lumberjack's disease? Lumberjacks, or people who fell trees, look up all the time to see where the tree's falling, and they are at high risk of dissections.
Wow.
In either the carotid or the vertebral artery.
Strange.
Right. So it makes me wonder. Chiropractors, I've obviously interviewed people who have had a stroke because they've been to chiropractors. And then I've heard, just through general conversation with people that I know, about women who go to the salon to get their hair done. They lay back in that sink where they have their hair washed, and that causes dissections and strokes. And it's like, oh my gosh, so many ways.
It's like you can't do anything.
Yeah.
One of the comforting things though about that is that I heard or read that it's only about 40% of vertebral artery dissections have like an identifiable traumatic cause. So there's still 60% out there that are just kind of idiopathic, or meaning we don't know why the hell it happened.
Yeah.
So.
Yeah, fair enough. So that first day, you're in hospital, you get the diagnosis, and then what happens? What's going on for you in your head, and what are you thinking?
It's just one of those things where it's so absurd that you almost just don't believe it, but in the back of your mind you do, and then you start spiraling, like, is my career over? Is this and that? And it's just you're just not in a very good place, frankly. It was weird because the hospital that I went to was where I trained as a resident for 5 years, and so many of the people that took care of me, and anything from the technicians to the surgeons, I had known a lot of them, so it was a very weird scenario. Good in many ways, and sometimes more awkward in others. So. Ultimately, like, very good, but yeah, it's strange to have your friend come in and see you, and you have a catheter sticking out or something like that, so yeah, but ultimately I would say it was a good experience, but yeah, so I don't to know exactly what I was thinking. It was just kind of all over the place.
Yeah.
I was worried and scared mostly.
Yeah. And you're swapping roles. Normally you're the caregiver, and now you're being treated.
Yeah, exactly.
Yeah, exactly. That would be bizarre, and especially when you're in that place with that you're very familiar with being the caregiver, and now the roles have reversed, and you have to be the person who gets cared for. And I can see how comforting it is to a point, because you're around familiar people, but then you're also in an unfamiliar role. You're playing a different role, and
exactly,
you have to be vulnerable, and these people are seeing you at your most vulnerable, and perhaps they haven't done that yet. They haven't had the opportunity yet, because prior to that they experienced you as this up and coming doctor and surgeon.
Yeah. So it was very bizarre, and I remember one of the general surgeons. He's now a trauma surgeon who I essentially trained with. He had to place my tracheostomy tube, and the rumor mill was that he was sweating bullets. It's like nobody wants to have a doctor as a patient. And then to take it one step further, no one wants to have a surgeon as a patient. And to take it one step further, no one wants to be a surgeon who has to operate on another surgeon. And so so I think he was pretty, sweating bullets, but I think ultimately he did a very good job, and I totally commend him for his equanimity through all the whole thing. He got it done.
Yeah, he would have been a professional, sweating bullets on the outside perhaps, but on the inside, being cool, calm, and collected, and getting the job done, and getting the right outcome. I mean, I remember going into my pre-surgery appointment with my surgeon the day of the craniotomy, and she was just full of life. She was just beaming, and she was alive, and she was having a laugh with her residents. And I went in there and felt just completely 110% confident in her ability to get the job done. And my AVM was near the cerebellum, and she said to me it was 4 centimeters in from the ear. And then she had one of the residents and had my scans on the screen and told him to explain to her the approach to the AVM, exactly how they were going to go about it.
Yeah.
And he got it wrong.
Oh, no.
And she gave him an elbow in the ribs and said, "What? Try again."
Yeah.
And he had to try again, and he had to make sure that he got the steps right and the approach was the correct approach. He got the approach from the top rather than from the bottom, and he got a couple of those little things wrong in front of me and my wife. We're both there.
Oh, gosh.
Listening to that, and we kind of laughed at him while she was gently reminding him of the correct approach and what they were actually going to do rather than what he thought was going to happen.
Yeah.
So that was interesting to be there and experience that. But I also remember chatting with her about the surgery months before, when I said, the previous surgeon that I came from told me that they can't operate, and you're telling me that you can. Is this something that you've done before? And she just looked at me and she said, "Well, this is what I do every day."
Yeah.
Of course I've done this before, and we can do this, and it will be a good outcome. So if the time comes, it'll be fine.
I love that. I love that question. Patients ask me that all the time, especially since I'm young. And my go-to answer is, yeah, I've done it like once or twice, just to give them a little confidence, right?
Yeah, absolutely. Just to make them feel silly for asking the obvious question.
Right.
That their fear made them ask. Otherwise, they wouldn't have asked.
Right.
So 35, well, we'll say he's young, because I was 37 and that was 10 years ago. And you're 30, you're only you're only 36 now. So
if you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.
what have you been able to do and get back to since the stroke? Are you back in any way in your capacity as a surgeon or a doctor? Are you doing any of that stuff, or are you still on the road to recovery?
I am. So I'm back in the capacity of like a clinical urologist. So I can see patients in the clinic, make diagnoses, prescribe, and I can do some very minor procedures in the clinic. I'm still not quite to the place I need to be to do any significant operations like in an operating room. Still working towards that, but so that may take a little more time. But I have regained quite a bit of ability. I still have some left-sided, left-hand ataxia. My balance is a little off. I mean that's not the balance issue is not enough to really preclude surgery or anything. But the left-hand fine motor manipulation is still fairly off. And so that, even though I'm right hand dominant, but that may keep me out for a while. So I'm still doing, rehab and things like that to try to get back to full capacity. But I'm not certain that I'll ever be like fully back to 100% in that regard. But things are definitely improving.
Yeah, I can relate to that. 10 years out, things have improved a heck of a lot. My left hand is still a little bit off the game. It's still numb and it's still a little bit off the game. And coordination is mostly okay. When I get tired, it just decreases a little bit and I get a little bit wonky on my legs.
Right.
And my left side wants to go to sleep before my right side for sure.
Yeah.
So that's interesting. Has this experience made you a better doctor?
Absolutely. I don't know. I mean, it's kind of like, especially, I guess, I mean, yeah, like in one sense, being a urologist who has been catheterized, that's a huge thing. That's like, it's funny because I used to tell people, oh, it doesn't really hurt coming out. It just hurts going in. And then I had one. And then I'm like, oh, I've been lying to people for the past 9 years. So yeah, I mean, there's lots of like practical examples, but I would say like more than anything, just the ability to kind of like really empathize and get down to the level of like what someone goes through when they are in fact sick, when they a surgery is planned and things like that. What are some of the things they think about? Like, what are their concerns? It's I think it was like Harvey Cushing was the famous doctor who once said, it's not enough to treat the disease, it's not enough to treat the diseased organ, but it's you have to treat like the entire patient and essentially like the world in which he exists. So it's kind of like, I mean, you can't plan to do something that might have a risk of someone like losing their entire career over and stuff like that. People have different motivations, people have different needs, financially, physically, emotionally in their lives. And I think I'm just a little better, or like more in tune with that, I guess you could say, now certainly.
Yeah, that makes complete sense to me. So the interesting thing that you said about the catheter is after surgery, they removed my catheter, and that was a task. And it was interesting experience to say the least. But then the night after the surgery, I had a real crazy temperature and things were going horribly wrong and they didn't know why. And my amazing nurse just pulled out all stops to make sure that I was well. Ice bags all over my body, the whole box and everything. And then he actually, and I was half out of it. And then he actually leaned into my ear and said, look, we're going to have to put the catheter back in.
Yeah, that's funny. I had a male nurse as well. And I was awake initially because I just hadn't urinated in a very long time, and I think it was more than anything it just wasn't on the forefront of my mind because of all the stress of everything going on that whole day.
Yeah.
And like 4 hours quickly turned into like 20 hours without urinating. And then the guy's like, we're gonna have to place a catheter. And I said, yeah, we probably should. And I gave him all kinds of pointers. I'm like, I do this every day, I've placed thousands of these. I gave him all these pointers, and then he looked at me like I was trying to sell him a timeshare or something, and he did not take any of my advice. And then it was the most painful, awkward experience. And I'm like, look, man, I'm this is like a master class right here. And he just did not care. No, not at all. It was painful.
Yeah. And look, my nurse did a great job. He was still painful getting it in, but I wasn't going to argue with him. I was really unwell. I wasn't going to at all give him a hard time about it. Just do what you have to do. And he got it in. And then, of course, we had to take it out again. So in a short amount of time, in 2 or 3 days, it went out and in and out again. And it's something that you remember. You definitely remember.
Oh, yeah.
So but it happened while I was being extremely well cared for. So it kind of takes the difficult part of the experience away, because I know that this guy was going out of his way to support me. And one of the challenges that he had was, because it was so late at night, he wasn't getting enough of the support from the attending doctor at the time.
Yeah.
And the doctor failed to pass on some information about blood tests, or to order blood tests or something like that.
Yeah.
And the next morning, my surgeon walked in and she was debriefing with both the doctor and the nurse.
Yeah.
And she said, where are the bloods? And the nurse said, I ordered them last night, but I haven't received them yet. And she looked at the doctor and she just tore shreds through him in front of me and everybody. And she said to him, next time an experienced nurse gives you this information, do not, under any circumstances, ignore them, and make sure that you deliver the bloods that they are requesting from you.
Yeah, exactly.
So knowing that those two people, and I know the doctor deep down had my best interests at heart, but knowing those two people really had my best interests at heart took away all of the difficulty that I experienced in the treatment that they were offering me. It was like, okay, it's just part of the process I've got to go through.
Right. Yeah. I think, having been in the medical field, like kind of recognizing some of these shortcomings and things, I'm like, yeah, I know that sometimes happens. I know why that would happen and all these other things. So I think it was helpful in a sense to kind of, at least it gives me some peace of mind that I'm not getting angry over silly things and stuff like that.
Yeah.
But,
yeah. So was the book something at the front of your mind? Was writing a book something at the front of your mind before all of this?
No, not at all. I was, actually I could say zero. I had never thought of that, at all. I mean, the only thing outside of, urology that I was doing before all of this, in terms of extracurriculars was, spending time with she was my fiance at the time, now wife, but doing that, fly fishing and painting. So I started painting with palette knives and things like that during COVID, but I had no aspirations whatsoever to write a book. And that thought occurred to me more as like a suggestion. So one of my urology colleagues had I was telling him some of these stories about, being catheterized and like some of the vivid dreams and things I was having under sedation. And he said, some of these things are really interesting, funny, whatever. You should really write these things down. And I said, no, I don't really want to remember a lot of these things. I just flat out told him no. And then he said, well, think about it. And so I said, well, my left hand is completely useless right now. It's like feral. Maybe I'll just write some of these things down, almost like a journaling exercise or something, just to because I do need to work on my typing skills. It's unfortunately a pretty big part of my job, and so it started more as like an occupational therapy rehab exercise, and then after a few pages, it seemed like it kind of wanted to take a life of its own on. And I was like, well, this may be valuable to other people, like to have this perspective and to maybe, kind of gain some insight on how to recover from stroke and maybe how to deal with like a really horrific, life-changing event, maybe with themselves or a family member or something like that. So I said, maybe there's some value to this. And so then this was like when I was in physical therapy, occupational therapy, doing an intensive daily therapy, that I actually said, okay, I think I'm really going to try to do this and write a book.
Let me tell you, it's a weird thing I'm going to say. It's really good when a doctor knows what it's like to have a stroke, but I hate that you have to know about it the way that you learnt about it.
Yeah.
It's terrible. I wouldn't wish that on anybody. I'd rather you never knew. But now that you know, since you know, absolutely the best thing that you could be doing is educating people on the stroke journey from a doctor's perspective, because I think you are going to make the lives of stroke survivors far more, far better, simply because you can now, you have both filters. You have the doctor's filter and you have the stroke survivor's filter, and bringing those together is such a rare, unique thing. And we struggle as survivors who don't have a medical background or don't know doctors. We struggle to bring the worlds together and then to also impart on the medical fraternity how they need to go about treating us differently than they treat somebody who's got a broken leg. And I'm sure, and I know they do, generally speaking, but it's the information that I've missed, for example, at every meeting with my doctor, because my brain's not comprehending what they're saying. It's the fatigue that makes it impossible for me to actually retain any of the information that I'm hearing from the other side of the desk. It's all that stuff that, it's all the noise, the extra noise, and the sensitivity to light, and the crazy things that happen when you're trying to do rehabilitation, and walking drains you for an entire day because you just started to learn how to walk again.
Right.
And that's the hardest thing you've ever done. So your insight is so useful. It's such an amazing thing. And now I think you're in a unique position to dramatically improve people's lives, and putting it in a book is such a great gift to us. And I hope that it gives you more back than what we're getting. I expect that it will, but it's such a great gift to stroke survivors who don't have your background, who don't know what you know about the medical world.
Yeah, it's very interesting. Like, there are definitely things, that I didn't know. Obviously, things that I learned along the way, and areas where I think there could be some improvement, and sort of things that I had to kind of figure out for myself. One example, would be like, there's not, or at least, I don't know, maybe it was just me, that maybe I wasn't seeking it out well enough. But yeah, there are a lot of us out there, you know, and I didn't find until very recently that having a community and like a fellowship of stroke survivors is just so crucial. And it was like a thought, you know, there's just a thought that never crossed my mind initially, because you had so many things on your plate. You know, it's like, I got to get my hand back to this good. I have to, you know, I need to walk without a walker. I need to learn how to drive again. I need to do all these things. And you know, one of the most important things, like having like a solid, you know, emotional foundation and a place of support where you can go and talk things out, you know, not having any of that stuff. Yeah, I just, you know, it was kind of confining. It made me feel very isolated in
Mm.
many ways.
Mm.
And now that I'm like I guess you could say active in a support group, it's just, it's incredible.
Yeah.
It's funny. The first meeting that I went to was on Zoom, and they recorded the meeting and they sent an email out to show me the recording, and I was smiling, like ear to ear smile the whole entire time. It was like a 45-minute or to an hour group, and there was not a second there where I wasn't smiling. It was just cool to like meet all these other people that were like me, that had, you know, experienced the same hardship, if not way worse, or maybe, you know, maybe a little better if they were lucky. You know, but it was just a great group of people. You know.
Yeah. And it it allows a doctor to hang out with people they normally wouldn't hang out with.
Yeah.
You know,
We
just
need.
because of, yeah, simply because of the world that you work in, you wouldn't hang out with a lot of these people. I've had people on the podcast that are doctors, and I've had people on the podcast that were gang members in LA.
Yeah. Mm-hmm.
And let me tell you, there's no difference between me, them, and you when it comes to talking about stroke recovery and our desire to get better and share and learn from each other and be and turn this thing that happened to us into some kind of a positive, to find a positive spin on it.
Right.
No difference between the three extremes of life, no difference at all, you know. And it's just so amazing to be able to and I never expected to have a gang member who has been involved in terrible things in his life before he grew out of that, and then became middle-aged, and then had a stroke, and then a doctor who's 35 who's doing surgeries and things like that. I've never hung out with people at either side of that spectrum before. It's such a world expanding thing to be able to experience, you know, in the most positive way.
Yeah.
Have you by any chance got a copy of the book nearby?
I do actually. I do. I have one here, I believe. If you give me 1 second.
No problem.
Yeah. Here it is. It's called the oh, sorry.
Yeah, a bit higher.
It's called the Stroke Artist.
Yeah.
Yeah.
And tell me a little bit about the book as far as what it's about.
So it generally starts out as just kind of like you know, what happened to me, you know, sort of chronologically. It's not, maybe a little bit of background, and then kind of straight into what the experience was. Mostly like the absurdity, the hilarity of some parts of some of this stuff. As it goes on, you know, it goes through. I mean, some pretty terrible things happen. You know, I think I had a total of 3, you know, brain surgery. I mean, well, I wouldn't say brain surgeries, but, you know, skull, then brain surgeries, and a lot of time in the ICU, a lot of time under sedation, um, during the sedation period, there were these, like, it was almost like living in a just a different world, like kind of like a vivid world, basically, that to me was just as real as you and I are talking right now. But I mean, it's kind of funny, in the step down hospital, I was asking my wife all of these questions, as if they had happened, as if they were real. And she said, "What are you talking about? Are you crazy or what?" I said, "Yeah, I think so." and and so then from there, we went through, like a stroke rehab program, um, kind of just detailing the experience, sort of what that's like, what the expectations were, what kind of therapy I was doing, and that sort of thing. And then, the end is more like, what's kind of like all my perspective on this stuff, and how has it changed, and how are things going to go moving forward, and that sort of thing. So it's just kind of a big summary of the whole process. It's a fairly short book, but I think that's good in the modern era.
Yeah, with the attention spans being as
Oh
short
yeah,
as they are.
yeah.
I love some of the things on the back page. There's a paragraph there that says, "Brave and irreverent, the stroke of an artist is an unforgettable first-hand divulgence of facing the unthinkable tragedy and emerging victorious to tell the tale."
Yeah. So yeah, I mean, the victorious in the sense that I'm here talking to you now. Whether I'm going to be a urologist again in my full capacity, time will tell. But it kind of puts things into perspective. Those things may all be secondary, in the grand scheme of things.
Yeah, and that'll evolve and emerge, and it'll all happen as your recovery continues to occur, and things become clearer to you, and things become to come into your awareness. And it might be that your role is completely different in this space, but it is still involved with influencing the medical world about how to go about better supporting or dealing with stroke survivors and their families. So you just never know. And that's one of the amazing things about putting yourself out there like this, writing a book, is putting yourself out there in a way that you have never done before. That's
Right.
far more visible than your role inside of a hospital ward and inside of a theater.
Yeah.
And we get to have a deeper insight into the mind of a human stroke survivor, surgeon, doctor.
Yeah.
That we very rarely get to have. And that's another gift that we get to have because of this shitty experience that you had to have.
Yeah. I appreciate that. It's well put. Yeah.
Yeah, my pleasure. The other thing that I like, I'm going to read pretty much the whole back of the book here, is at 35, Dr. Bevan was a successful surgeon and the captain of his own ship. Suddenly, in the blink of an eye, he was alone and adrift, the victim of a massive stroke. And then you've got quotations. "Your thinking self begins to panic. You're revving the engine with the pedal to the floor, but the clutch is still in first gear. You have been told by every impassioned therapist that the brain is an amazing thing, and they all have a story of Methuselah returning to rollerblading at 6 months after his stroke that was worse than mine. So you ask yourself the impossible. You say, 'Look, you son of a bitch, we are going to do this, even if it kills us both.' And you make something happen. The first few times you look like an absolute fool. You stumble. You literally drop the ball. You are failing, but at least you are doing it in style. Then, after lots of failing, you begin to start succeeding. You accomplish the impossible. Your soul, your being, your amazing brain just won a battle that puts you that much closer to winning the war.
Yeah.
Man, what a couple of paragraphs there. That is some powerful stuff.
Oh, thanks. Yeah, yeah. It's just kind of my my personal experience with some of these things like I don't know, walking, for instance. Like anything, I mean, it's how many how many skills do our therapists ask us to try to do, and then we just at some point we just have to kind of do it, out of thin air, use some previously unused part of your brain to try to make up for maybe a part that's now gone. And so it's yeah, it's very difficult as you know, right? But like but yeah, it's incredible, like what I think people can do. And I'm not the only one that's experienced something like this. I think several thousands, if not millions of people have. But yeah, it's a pretty incredible process.
Yeah. In hindsight, do you think that your career set you up for a really good outlook on stroke recovery, and did it help you with your thought process of how to tackle this, and perhaps seeing all those amazing stories of people that you've helped to recover from serious stuff? Did it help?
Yeah, I think I think people's, it's kind of weird to put these in the same sentence, but maybe like people's willpower and maybe even like their spirituality and things like that definitely do have a bearing on like their medical and surgical outcomes. I can't quote any papers, but it's like one of those things, you just know it when you see it. And so I think I think it's definitely helpful. Yeah, it's difficult sometimes to to always like at least in my initial recovery, I was kind of like a sponge. I was like, oh, because and sort of with a sponge that has a slant towards, am I going to get better? Am I going to get better? And, everything you hear that's positive, you kind of put that in your pocket and keep going. But and then the negative stuff, you're like, well, it may not be me. I don't know. But yeah. So, but I will say that, I think those things are important. I think, I think a lot of the things I heard were very helpful. Some of the things that I heard that I know, people were coming at it from, they were definitely in my corner, but to me, it sounded very different when people were saying like, well, you're going to be okay. I mean, you're so young, right? Like, you're going to be fine. You're so young. And I'm saying like, well, do you know that? Like, are you a qualified, are you a prophet, or are you a qualified, medical person to say something like that? Because when I heard people say stuff like that, it kind of like felt like it put all the burden on me. Like if I don't get 100% better, it's going to be because I was lazy, because I should have been able to do this. I was young. I am young. I should be able to make a full recovery, right? And they don't know that, and you don't know that. And so I think it's, some of the promise of that is a little kind of much for maybe a young stroke survivor to hear.
Yeah. You know what I think that is? I think, because I had the same experience, I think it's the other person. It's obviously more about them than it is about you, but it's the other person trying to convince themselves that you'll be okay,
Right.
so that they don't have to deal with your lack of being okay, or your death, or your total and permanent disability, or whatever it is.
Right. Yeah.
Right. So what they're doing is they're putting it out there. They're hoping that you're going to say yes, so that they can go home and sleep at night.
Right. Right. Yeah. Yeah. I think, Yeah, and that's fine, you know. I mean, in a situation like that, I mean, it's kind of like, you know, I don't know how things are going to go for me, but you know, things might as well, you know, go pretty well for you. That's
Yeah.
fine. That's great. Um, but yeah, and you know, like there were many times in my hospitalization where I came pretty close to dying. Not that I necessarily remember those. I feel
Mm.
more sorry for like my family members and my wife. Um, but but yeah, I heard a lot of well, if you survived that, then you know basically getting back to 100% will be a you know walk in the park. And then like
Yeah.
it's not. It's definitely the hardest thing I've ever tried to do in my entire life.
Yeah. And, you know, on the other end of the spectrum of that version of response from somebody who comes to visit you is the doctor that says to their patients, you'll probably never walk again, or
Yeah.
let's expect not too much from them. It's probably all they're going to regain. And it's like, oh God, like, why would you say that? What's behind the mind of a doctor who gives an opinion like that rather than makes a statement based on fact, on solid evidence? You know, that
Right. Yeah. I
really
mean, I
challenges
think
me.
yeah, yeah. I think there are definitely some situations where there are not enough facts or data points like for the physician to make an accurate statement. And then there's the situation where they probably do have enough data points, but they seem to want to um, like set expectations low so that if they are exceeded, then you both look good. And so it's kind of like yeah, you get a lot of this I guess sort of negative self-talk or negative thinking in the medical field too often. And I think it's you know like has to do more with like brain chemistry, where if you say, oh well, this thing probably won't go well tomorrow, you know, the hand we're dealt is bad, like things will probably not go all that great. Well, if they don't, then you know your brain gets a little dopamine hit because you were correct. And if you were wrong and things go really well, then you know the brain gets a massive dopamine hit. So it's a win-win either way, you know. And I think that's not totally unique to doctors. I think a lot of people do this when they
Mm,
say, "Oh, this meeting's not going to go well tomorrow," or "My
mm,
presentation's going to be bad," or "This
mm.
job interview is going to go poorly." And I mean, I don't know. It's a really negative way to live. I don't think
Yeah.
people find that way of living very fulfilling. But but I think, but yeah, it definitely is more you know pervasive in the medical field. A lot of
It's
that,
just,
like
yeah, there's more at stake in the medical field, you know, when you're giving that kind of feedback to somebody. There's
right,
just way more at stake. And you can set the person off down a negative spiral of,
right,
you know, losing hope. And what I feel doctors should be doing is offering hope where all hope seems lost. Because let's face it, that's what you actually do when you take somebody under into the surgery and you use a scalpel to open them up. Before you amazing people existed, there was no hope for those people.
yeah,
And now surgeons only in the last 100 years are offering hope where there was no hope before. So they're doing all this amazing stuff, and then they're dropping the ball in that space. You know, some doctors are dropping the ball in that space where they could offer hope, but we understand not set the expectation too high. So then they'll let
right,
people are let down because you said I was going to be 100% better or whatever. No. We
right,
don't want that either. But we also don't want doctors to just decide that we are probably not going to see much better results than that, and to be blind, to be unaware of their own blind spots. I suppose that's what it is, actually. That's where I'm coming
yeah,
from, you know. And I
yeah,
get And I get they're doctors. They want people to get better. That's what they do for a living. It's just that sometimes those words come out of their mouths, and lots of people that I've interviewed on the podcast will tell me that that's what they experienced, and they are grateful that they proved their doctors wrong, and it's kind of like a win. It's waha, I proved them wrong. And
it's empowering on their part for sure.
But I never hear from the people. The people that are not on my podcast are not the ones that haven't done well. Do you know what I mean? I'm not getting contacted by people to be on the podcast when they are doing it really, really badly, and they don't want to, and they don't recognize any part of their life, and life's terrible and all that stuff. None of those people are contacting me. So I'm wondering about them and where they are and how we can reach them. And I'm hoping we're reaching them and just offering them hope here. That's what I want to do.
Yeah. And to your point about the expectation setting, I've seen doctors operate on both ends of the spectrum where they promise patients the world, which is wrong, which is totally wrong. And then there's the ones that are like, this is probably not going to go well, and it wouldn't say it that way, but I mean, they're hinting at that, and you definitely have to find a middle ground. And just, I think it's weird because like some patients will just, more than anything, they want to be, I think they want to be, they always say, shoot me straight, like tell me exactly what is going on, what's the prognosis and this and that. And sometimes, we could lose sight and how we deliver that information. So I think it's important that you have to be, truthful, honest, and open. But I think you can have a little more tact and I think and to the people that have that may not necessarily get the outcomes they want. I think one of the things is like my whole perspective on like the kind of my life, even like a lot of things going on in my life after the stroke, is that I try not to really set goals anymore. That sounds pretty bad, right? Because we're all told since we're kids that we got to have goals and we got to achieve them and everything. But I try to like live in such a way where I have like either repeatable habits or like repeatable habits that bring me joy. Like, for instance, I started trying to run again, and from a guy that used to run maybe 30 miles a week, I hit a like a little benchmark the other day of half a mile. I was totally proud of myself, and the only reason was because I did just a little bit more like every day, and I wasn't like, okay, well, I think I'm going to start with 2 miles because that's anybody should be able to do that. That's not true. I mean, and I think sort of tempering those things that we call goals down to like things that we may look forward to and need to kind of have some sense of fulfillment, like and just keeping them in more of a habitual format, I think is very good, and it can be very fulfilling for people.
Yeah. One of the people that I met very early on, probably 10 years ago, very early on in my recovery, was somebody who had a stroke and following his journey to getting back to walking. And I remember one of his first posts was that he managed to walk, I think it was, 10 meters or some very small distance. And he said it only took half an hour or something like that.
Yeah.
And it was phenomenal to read his post about how something that he would have done without thinking about just weeks earlier happened to become one of the most dramatic experiences of his life after the stroke, to get to walk that short amount of distance, and it only took that long. It's like, wow, okay. So what I knew from that was that he had in his mind, the goal was to walk further and in a shorter amount of time at some point no deadline on it, no timeline. Just let's see if I can improve on yesterday and go a bit better the next day. And wasn't hard on himself when he didn't improve. He was just up and getting up and just trying to get further and further. And now, 10 years down the road, he still has a walking, a four stage walking cane, or I'm not sure what they're called, and he's quite mobile and quite active and getting back to work in the capacity that in a field that he was previously involved in. And his life has improved. His life is getting back on track. He does face a lot of challenges and struggles that other people don't, but he's not letting those things stop him from going after his wins. And he hasn't said this to me, but it's exactly what he's doing. He's doing small, repeatable things that, as a result of that, get him at the beginning very small gains, and then those gains just compound and they become greater and greater. And then 10 years down the track, he's looking back going, look how far I've come, figuratively and literally.
Yeah. It's good. Yeah. Cause if I said, well, I should be able to run 2 or 3 miles now, because before I could run this far, and then, if I tried to do that, I'd likely fail. To be honest, at this point, I'd fail, and then I may say, well, I'll get back to it, and then I just never would. And as simple as that, So yeah, I think there has to be a little bit of a psychic shift when it comes to how you view fulfillment and things like after a stroke. And I'm not saying you have to lower your standards, but they're just different,
Yeah, they are. They're still high standards. They're just differently oriented, and the approach is different, and how hard you're going to go has to be different, and how gentle on yourself has to be different, because you are, I like to think that the people that go through something like we've been through are evolved. It may not appear that way at the beginning,
right?
But they are evolved. They are living a life that very few people get to live and experience. Most people get to live and experience, this is just me making up stories perhaps, the quote unquote normal life. Very few people get to experience that evolved version of life, because it's growth that happens. You have another perspective on life that lots of other people don't get to have. And I don't necessarily want that to be a negative thing for people. I don't want it to only be negative. I want them to also experience it as a wow, like as a wow moment. Not only this is difficult, horrific, terrible, and all the things that it could be. Right. Why can't it be an evolved version of existence, of being, that very few people get to experience, and therefore that makes you wiser, greater, to be able to empathize with a far larger group of people in our community than before.
Yeah.
And use that to make your life and their life better.
Right. Yeah. I totally agree with that. It doesn't all have to be doom and gloom, as they say,
No, it definitely doesn't. So your book, The Stroke of an Artist, is available where? If people want to reach out to connect with you, and buy the book, where would they go?
So you can go to, it's The Stroke Artist, all one word, .myshopify.com, or The Stroke Artist is also on Amazon.com, which I think is probably the easiest way to get the book. Yeah.
Excellent. And it's a real inexpensive purchase. I see. It's not that expensive to buy. You can also get it on Kindle, which is the electronic version.
Yeah.
And probably the only thing missing is the audio version of it. Did you manage to get an audio version out?
No, maybe later down the road. I gotta see where I'm at, but yeah, not quite yet. Would you want to do the audio version for me?
Well, you never know. I might too, but you know what I love about audio books is I download the ones especially where the author has narrated the book.
Yeah.
Because then I get to hear in the author's own voice,
right,
and expressions what they're trying to say in words in the book.
Yeah, absolutely.
And it's a far better experience than an Aussie guy trying to read the book of an American guy who's a doctor and a surgeon. And this guy over here is just a tradesperson who's only ever worked as a painting contractor.
Okay. All right. Fair enough. Fair enough.
I'm not that good of an actor that I can pull off a surgeon from the United States. I couldn't do it. So anyhow, it's just something. And the reason I mentioned it is because lots of people can't read after a stroke. And at some point, they may love to hear your book instead of read it.
Yeah.
And it's just something for you to think about for the future. It's no pressure there. And that's why I love the podcast, is because I get a video version that goes on YouTube for people who want to look at us.
Right.
I turn an audio version for podcast, Apple iTunes or Spotify. And then I get somebody to transcribe everything that we've said and put it into a document that they can download from my website.
Yeah. I mean, I completely understand that. I certainly couldn't read, immediately after the stroke. It took me a while. I had to wear those. Well, for a while I had prism glass, or I started with an eye patch. Then it went to prism glasses, and then it went to +1 readers, and then ultimately my vision, after lots of vision exercises. Gosh, I didn't even know there was such a thing. But now my vision is, at least I feel like it's back to normal. I think it's back to normal.
Yeah, that's great. The worst gift that somebody could bring to you after a stroke in hospital is a book that's that thick.
Yeah, exactly.
And expect you to read it.
Yeah, I mean, I couldn't read text messages. That I was kind of a nightmare. And the prism glasses are they need to try to make those look a little more chic. They're pretty bad. They one of the nurses in the rehab hospital asked me, she saw me wearing the prism glasses, and for those who've never seen them, they're like these gigantic Coke bottle, circle glasses. And she said, "Do those things work?" And I said, "Oh yeah, like nobody hits on me anymore."
Yeah, man. They work to keep everybody away.
Right, exactly. Yeah.
I know the ones. You see, they're those little things. That really makes a massive difference for some people who are in recovery, right? Is not having to wear something that looks so terrible. That would really make a huge difference. With children now in Australia, at least, I don't know about anywhere else in the world. Prosthetics, a lot of prosthetics are getting pimped up with, Marvel characters or the favorite Disney character or whatever, so that the child sees this thing and instead of being repelled by it,
right,
is drawn to it and wants to have it on because look how cool it looks. And can you imagine all the amazing feedback and comments they get, rather than stares and the oh my god, they get all these beautiful responses, which are, wow, I love Spider-Man, perhaps, or oh my god, isn't that a pretty Disney character or whatever. And it's like those little things make a huge difference to the way people feel about how their identity has changed since that experience of their ill health has impacted them,
Right. Yeah, absolutely.
Bevan, I really appreciate you reaching out and filling out the form and saying, "Can I be on the podcast?" Man, it was a great pleasure to receive that email and then have you on the podcast, get to know you a little bit and share your story. And hopefully you go from strength to strength, and your book makes a big impact on people who need to read it, and your career evolves so that you can get back to doing what you love, as well as hopefully improving patient outcomes, just because you're a doctor who had a stroke.
Yeah, I appreciate that. Yeah, it's weird. Obviously I didn't think about, any of these things like initially right after the stroke, but yeah, over this past year, I'm kind of like, yeah, I don't know, like maybe I could probably help a lot more people in this space than what I was doing. Not that what I was doing wasn't like my career or whatnot and what I wanted to do, but yeah, it's just kind of giving me a whole new perspective, and it's a very cool community.
Yeah. Well, I'm not glad you're part of it, but thanks for being part of it.
Absolutely, I'm glad to be a part of it now. That's for sure.
Thanks for being on the podcast.
Absolutely, man. Thanks for having me on.
Thanks for joining us on today's episode. I really appreciate it. I told you it was going to be a cracker. Dr. Bevan Choate, unfortunately, has become a stroke survivor, but isn't it amazing the kind of role that he's decided to take after his experience with a stroke, and the message that he's trying to put out there, and the impact that he's trying to make as a stroke survivor for the rest of the stroke survivors and the rest of this community. I think it's to be commended, and I really appreciate him sharing his story. Go ahead and check out his book. In the show notes, you'll find the links to his Instagram and where you can get the book. And I really would love to encourage you to comment, like, and share this episode. If you're watching on YouTube, comment, subscribe, hit the notification bell to get updates of new episodes as they become available. The more interactions the episode has, the more the algorithm will push the episode out to the people that need to see it, and the greater the impact the interviews will make. Thanks again for being here and listening. I really appreciate you.
Importantly, we present many podcasts designed to give you an insight and understanding into the experiences of other individuals. Opinions and treatment protocols discussed during any podcast are the individual's own experience, and we do not necessarily share the same opinion, nor do we recommend any treatment protocol discussed. All content on this website and any linked blog, podcast, or video material controlled this website or content is created and produced for informational purposes only and is largely based on the personal experience of Bill Gasiamis. The content is intended to complement your medical treatment and support healing. It is not intended to be a substitute for professional medical advice and should not be relied on as health advice. The information is general and may not be suitable for your personal injuries, circumstances, or health objectives. Do not use our content as a standalone resource to diagnose, treat, cure, or prevent any disease for therapeutic purposes or as a substitute for the advice of a health professional. Never delay seeking advice or disregard the advice of a medical professional, your doctor, or your rehabilitation program based on our content. If you have any questions or concerns about your health or medical condition, please seek guidance from a doctor or other medical professional. If you are experiencing a health emergency or think you might be, call 000 if in Australia, or your local emergency number immediately for emergency assistance, or go to the nearest hospital emergency department. Medical information changes constantly. While we aim to provide current, quality information in our content, we do not provide any guarantees and assume no legal liability or responsibility for the accuracy, currency, or completeness of the content. If you choose to rely on any information within our content, you do so solely at your own risk. We are careful with links we provide. However, third-party links from our website are followed at your own risk, and we are not responsible for any information you find there.